Hello, this is Dr. Tyler Hamel, Kingwood chiropractor. Today we're going to talk about anterior pelvic tilt, meaning that the pelvis here, we see some people, it goes forward this way. So why is that important? Because lots of times that's going to cause extension in the low back and low back pain eventually. So again, your pelvis, it can go forward, it can come backwards. Lots of times as patients come in with low back pain and it's forward. So how can we fix anterior pelvic tilt? It's a few different things. So we look at number one, hip flexor tightness. Okay, number two, gluteal tightness. And number three, we have ab weakness. So we have to stretch this, we have to strengthen the glutes, we have to strengthen the abs, all in a way that helps support the pelvis and the low back. So number one, stretching hip flexors. Basically, I'm going to put knee down, whatever knee is down, that's what I'm stretching. So stretch the left side, I'm going to lunge forward this way and just lift up my arm like so. You should feel a pretty good stretch in this area here. Hold it 30 seconds, 45 seconds, something just to get a good stretch there. Number two, so gluteal strengthening exercises. We hear about lunges, anything that you can do to focus on the glute itself. So I have a couple different ones to do. First, laying down, say on a mat or a table. I'm going to be flat, just put my hands underneath my butt like this, legs down. I'm just going to squeeze my butt, relax, squeeze, relax. And when you do that, you'll see your pelvis come up and down. You can do that both at the same time, and then you can just do one cheek at a time. Again, you're just underneath your hand, you're trying to feel your butt or your glute muscles getting stronger, right? Contracting. Another one you can do, this one's a little more intense. If I'm trying to activate this glute, I put all the weight into my left foot, and I'm gonna raise my right knee up, keep raising it, and you should feel a pretty distinct contraction in the gluteal muscle here. Okay, so we did hip flexor stretch, gluteal strengthening. The next one is abdominal strengthening. So we want to do abdominal strengthening, but we want to take hip flexors out of it. So we do not want to do a crunch type of position because that's bad for the hip flexor, bad for the low back. So we can do things like side plank. Say if we're on the floor, we can come up this way, and we're just going to hold it for 30 seconds, 45 seconds, a minute, whatever you can get up to. You might be shaking a little bit, which is okay. We can do front plank this way. When we're going to come up, just make sure your pelvis is kind of tilted backwards this way. So we want to keep flat. Same thing, 30 seconds, 45 seconds. Those three things will help fix anterior pelvic tilt, which lots of people might think, well, I don't know if I have that or a big deal, but the big deal is how much extra stress it puts in the low back. When your pelvis is forward this way, it's going to make your low back extend. Right? So three different stretches, exercises: hip flexor stretch, gluteal strengthening, abdominal strengthening. And hamstrings can be a little bit tight in this with this problem, but it's just because your pelvis is being rotated anteriorly. So it's not actually tight. We have to fix what's causing the hamstrings to be tight in the first place. So anterior pelvic tilt, back pain. Any questions, put in the chat box below. Dr. Tyler Hamel, Kingwood chiropractor. I've been doing this for over 20 years. So if you have any questions at all, just put it in the chat below and we'd be happy to help you. Thanks for watching the video.